Alcoholic liver disease, ALD, is a serious health condition that results from prolonged and excessive alcohol consumption. It is one of the leading causes of liver damage and can lead to life-threatening complications if left untreated. ALD progresses in stages, starting from simple fatty liver, known as steatosis, moving on to alcoholic hepatitis, and in severe cases, developing into cirrhosis. Each stage comes with its own set of challenges, including inflammation, tissue damage, and scarring, which compromise the liver's ability to function properly. While current treatments focus on lifestyle modifications and symptom management, they often fall short in reversing liver damage, particularly in advanced cases. This brings us to a novel approach in the form of umbilical mesenchymal stem cells, UMSC therapy, which has shown promising potential in recent research. Umbilical mesenchymal stem cells are derived from the Wharton's jelly found in umbilical cords. Unlike other stem cells, UMSCs possess unique characteristics that make them especially suitable for treating liver conditions. One of the most remarkable features of UMSCs is their strong anti-inflammatory properties. To understand their impact on ALD, it's important to first grasp how inflammation plays a key role in the progression of the disease. Chronic alcohol consumption triggers an overactive immune response in the liver, resulting in ongoing inflammation. This inflammation further damages liver cells and accelerates the disease process. Traditional medications may help manage inflammation, but they often come with side effects and limited efficacy. Here, UMSC therapy emerges as a game changer. UMSCs have the ability to modulate the body's immune response. When introduced into the body, they secrete anti-inflammatory cytokines that help calm the overactive immune system, reducing inflammation in the liver. This modulation of the immune system is crucial because it not only alleviates current liver inflammation, but also prevents the immune system from attacking liver cells in the future. By creating a less hostile environment, UMSCs give the liver a chance to recover and function more effectively. This is particularly important in the early stages of ALD, where controlling inflammation can significantly slow disease progression and prevent further liver damage. Beyond their anti-inflammatory effects, UMSCs exhibit significant anti-fibrotic properties. Liver fibrosis is a key concern in ALD, especially in the later stages where cirrhosis develops. Fibrosis occurs when the liver tries to repair itself after injury, leading to excessive scar tissue formation. This scarring disrupts the liver's structure and impairs its functions. UMSCs can tackle fibrosis in two primary ways. First, they inhibit the activation of hepatic stellate cells, which are primarily responsible for the production of fibrous tissue. By stopping these cells from creating more scar tissue, UMSCs slow down the fibrosis process. Second, UMSCs release enzymes that help break down existing scar tissue, promoting the restoration of normal liver architecture. Clinical trials involving UMSC therapy in ALD patients have shown encouraging results. For instance, patients who received UMSC treatment demonstrated a notable reduction in liver enzyme levels, indicating decreased inflammation and improved liver function. In some cases, imaging studies post-treatment revealed a reduction in liver fibrosis, underscoring the potential of UMSCs to not only halt, but also partially reverse liver damage. While these findings are preliminary, they provide a glimmer of hope for patients struggling with ALD, particularly those in advanced stages of the disease. UMSCs also promote liver regeneration, which is vital for restoring the liver's functionality. In ALD, constant alcohol-induced damage reduces the liver's ability to repair itself. UMSCs release a variety of growth factors and cytokines that encourage the proliferation of hepatocytes, the main cells responsible for liver function. By enhancing the liver's natural regenerative processes, UMSC therapy can help rebuild the liver's structure and restore its metabolic capabilities. This regenerative potential sets UMSC therapy apart from other treatments, which generally focus on managing symptoms rather than addressing the root cause of liver dysfunction. It's essential to understand that UMSC therapy is not a standalone cure for alcoholic liver disease. Instead, it should be seen as a complementary treatment that works best when combined with traditional approaches such as alcohol cessation, dietary changes, and medical management of symptoms. Lifestyle modifications remain a cornerstone of ALD management, as continued alcohol consumption can negate the benefits of UMSC therapy. Therefore, patients considering UMSC treatment must commit to a comprehensive care plan that includes abstaining from alcohol, following a nutritious diet, and adhering to prescribed medical regimens. UMSC therapy is most effective when the liver is given the best possible environment to heal and regenerate. Despite its promise, UMSC therapy for ALD is still under active investigation. Researchers are exploring various aspects of this treatment, including the optimal dosage, delivery methods, and long-term effects. Studies are also looking at how UMSCs interact with other cells in the liver environment, such as immune cells and hepatic stellate cells, to better understand their mechanisms of action. Understanding these interactions is key to maximizing the therapeutic benefits of UMSCs while minimizing potential risks. In addition, ongoing research is examining the use of UMSC-derived secretomes, which contain a mix of growth factors, cytokines, and other bioactive molecules, as a potential therapy that could offer similar benefits without the need for cell transplantation. One area of particular interest is the potential of UMSC therapy to improve the quality of life in ALD patients. Current treatment options, especially for those with advanced cirrhosis, are limited and often involve managing complications rather than improving liver function. UMSC therapy offers a different approach by addressing the underlying inflammation, fibrosis, and loss of regenerative capacity in the liver. Preliminary clinical trials suggest that patients undergoing UMSC therapy experience improvements in symptoms such as fatigue, jaundice, and abdominal discomfort, leading to an overall enhancement in their quality of life. It's also worth noting that umbilical mesenchymal stem cells have a favorable safety profile. Since UMSCs are derived from umbilical cord tissue, they are considered immunologically naive, meaning they have a lower risk of causing immune rejection when transplanted into a patient. This makes UMSC therapy accessible to a broader range of patients, regardless of their genetic background or previous medical history. However, as with any medical treatment, it is crucial for patients to undergo a thorough medical evaluation and consult with healthcare professionals to determine if UMSC therapy is appropriate for their individual case. In conclusion, umbilical mesenchymal stem cell therapy represents a promising and innovative approach to the treatment of alcoholic liver disease. With their anti-inflammatory, anti-fibrotic, and regenerative properties, UMSCs offer a multifaceted strategy to tackle the complex pathology of ALD. While more research is needed to fully establish the best practices for UMSC therapy in liver disease, early clinical evidence points to their potential as an effective adjunct to traditional treatments. As our understanding of stem cell therapy continues to evolve, UMSC treatment could become an integral component of comprehensive care for patients suffering from alcoholic liver disease, giving them hope for improved liver function, reduced symptoms, and a better quality of life.